Okay, so today's video is on TENS. Indications for TENS include pain control, pain modulation. Contraindications for TENS include anyone who's pregnant, anyone who has pacemaker, areas of the skin that are damaged, where there may be thromboses or hemorrhaging, or areas of tumors. So let's come over here to our patient, Will. Hi, Will.
Hello.
Hi, I'm Juan, student physical therapist treating you for your knee osteoarthritis. And obviously you have some pain associated with that. So today what I want to try with you is putting you on some TENS. Basically this is just a electrical stimulation that's purpose is to control your pain. And it does that by sending more vibration signals to your spinal cord versus the pain signals that you're currently sending to your spinal cord. So you're kind of just blocking those, and it should be relieving. Basically I would do this, I'm gonna put these pads just around your knee and turn the intensity up until it's at a comfortable setting. Okay, so it's just supposed to feel like a relieving vibration. There shouldn't be any discomfort, shouldn't be any like twitching or pain with it. Okay. Is that something you'd like to try today?
Yeah, let's try it.
Cool. All right, so let's lay you down here. And I'm gonna just throw this pillow underneath your knee for a little more comfort. And are you feeling okay? Okay, good. So, a couple things we want to do before we actually start him on the TENS. First is see if he does have any of those contraindications. Do you have any like history of blood clots or hemorrhaging around your knee?
No.
Do you have a pacemaker?
No.
Okay. So just things like that we want to double check. We also want to check to see how his skin is looking. So like we said before, we don't want any damaged skin. Right now his skin looks fine, so we're safe to go ahead with the treatment. So what I'm going to do next is just place these around his knee here. Just like this. Good, and then we could come over here to the machine. So we're doing high rate TENS with this. So this is a biphasic pulse current, and it's going to be continuous. And then if we come over here to the time, so usually for the first treatment with TENS, you want to stay on the lower end, so maybe like half hour or less, but with subsequent treatments you could basically go for a few hours if you'd want. So then coming down to rate, we are going to push that up to 80. There, and for our width we're gonna come down to 100. And then now I'm gonna start the intensity. So Will, I'm just gonna start raising the power up a bit. I just want you to tell me when you start feeling that buzz, okay? So we could start doing that. Starting to feel it at all?
Very little.
Very little, okay. So we'll keep going. And you let me know when it's just kind of like a comfortable tingling.
A little
little more.
Right there is good.
Okay.
Yeah.
Great. So now we could just go ahead and start that. And the timer's running down. And so yeah, like I said, we usually put the patient on this first time, maybe like half hour. For the purpose of this video, we're only going to do about 30 seconds. And as we go through the treatment, we just want to check in with our patient, making sure he feels okay. Are you uncomfortable at all, or does it feel all right?
Just buzzing away.
Great, yeah. And then also, sometimes with electrical stimulation, the first few minutes they might feel the intensity pretty well, but after that, they could kind of get used to it. So it's good to check in and see if they want to raise intensity at all. Are you doing good?
Yep.
Cool. So basically, that's the procedure for TENS. After this, we would take them off. So let's demonstrate that. We just stop the machine here. Then we'd want to take off the pads from the knee, making sure that there hasn't been any damage to the skin or anything like that. And he looks great here. So after this, we could either send him home or continue with the treatment, whatever we're doing for that day. So thank you.